Well, welcome everybody. Good afternoon. My name is Vance Drakeford. I'm going to be one of the presenters on today's call. First, we just want to get started. Today's webinar is about the Quality Payment Program Year Six's 2022 eligibility. So just a few housekeeping items as we get started. If you have any questions throughout the program, please go ahead and enter that in our Q&A box, and we will address those at the end of the webinar. And so if you have questions, go ahead, please fill that out, and we're happy to at the end. One thing that I did want to let everybody know that the information contained in this presentation is for general information purposes only, and the information is provided by the Kentucky Regional Extension Center at UK Healthcare. And while we try to keep the information up to date and correct, we make no representations or warranties of any kind, express or implied, about the completeness, accuracy, reliability, suitability, or availability with respect to the content. So many of you may know, and for those of you that don't, the Kentucky Regional Extension Center has been around now for about 11 years, and we provide all kinds of services across our state. We've helped over 5,000 providers in Kentucky. We help FQHCs, rural health clinics, all types of healthcare organizations in our state. We provide services for our HIPAA security risk assessments, PCMH and PCSP consulting. We also help with the value-based payment or the quality payment program and MIPS support, quality improvement support, as well as telehealth services, as well as hospital services for our promoting interoperability for hospitals, hospital security risk assessments, and quality improvement support for those hospital organizations as well. So as I mentioned a minute ago, I am one of the presenters today, and I am joined today by my friend and colleague, Robin Colonel. And we also have our team of advisors joining us today that we always, we have a great group of people that we help our clients with, and they are joining us as well. So as we get into the topic for today, for eligibility, we're going to talk about, I'm going to go over the Year 6 program essentials for the program, and then we'll dive into some eligibility across the different programs, and then how we help here at the REC can help you. And then again, we'll go over any questions that you all may have. So let's get started. Just to get things kicked off here, I just want to talk about the Quality Payment Program. It was started by the MACRA legislation back in several years ago, and it really requires CMS to kind of implement an incentive program. And they came up with a QPP, or the Quality Payment Program, and there are two separate tracks for this program and how you participate. You can either have the MIPS track or the Advanced APM track. With the MIPS track here on the left side of the screen, you're going to notice that stands for Merit-Based Incentive Payment System. And this is where there are eligible clinicians for the MIPS program that are subject and required to a performance-based payment adjustment through the MIPS track. There's also that Advanced APM track here on the right side in yellow, which is the Advanced Alternative Payment Model track. With this track, QPs, or qualified participants, can earn an incentive payment for participating in one of these types of models. So, like I said, the two tracks, MIPS and APMs. With your MIPS track, you have the traditional MIPS. That is what probably most people are currently in. So with that track, there's all kinds of measures and activities that you can choose from, how you can report, whether that's at a group, individual level, or a virtual group level. And with that track, you have the potential of earning up to a 9% positive or negative payment adjustment. Coming next year, there's going to be a new track in MIPS, and it's the MVPs, which stands for the MIPS Value Pathways. This is something that they're beginning, and you are not required to start next year, but you are able to do that if you want to. They have a subset of measures, and it's really, I like to think of it as a package deal where the measures and activities are kind of chosen depending on the MVP that you choose to participate in. And then moving outside of the MIPS track, let's move over again to the APM track. So within that, the alternative payment models, you have APMs and MIPS APMs, and these are really different models that you can participate in for high quality, and they're more coordinated and cost-efficient care. And they're coordinated around a specific clinical condition usually, or a care episode, or a type of population of patients is how that APM is usually created based upon one of those things. You can have different ACOs, you have your bundled or episode-based payments. And there on the screen you see the CPC initiatives too. So those are some examples of the different types of alternative payment models. And then within this track, there's also an advanced APM. So CMS has a list of designated advanced APMs that they've determined. And within that, that's like a subset of an APM. With these, there's both an upside and a downside risk potential for your outcomes and your cost. So if you perform really well, then you have that potential to earn that upside adjustment. But also, if you don't do so well, you have that downside risk of maybe having a penalty. If a provider is in an advanced APM and they are deemed a qualified participant, a QP, then they have that potential to earn a lump sum 5% incentive payment on that too. So as we get into the MIPS track, for this year, 2022, there are category weights, and you'll see that listed here on the slide. You're going to have 4 categories: the quality, the PI, the IA, and the cost categories. Each category has different weights associated with the program. So you'll notice that the quality and the cost categories are both weighted at 30% of the overall program. And then your PI category is at 25%, and your improvement activities are at 15% of the total MIPS program. You are required to submit a time frame of data for each of the categories. For quality is a full year, so you have to submit all of 2022 data for your quality category. With the PI and the IA categories, you are able to choose your highest performing time frame of 90 consecutive days. So whatever is the best 90-day period for you, you can choose that to submit those 90 days for those categories. And then cost is a full year, but cost is that category that you don't have to do anything for. It's based upon all the claims that you submit throughout the year that CMS calculates and reviews and determines if you do qualify for cost measures. And so it is based on the full year, but you don't have to submit anything. Another reminder is that for 2022, once you submit that information, which will be from next January 1st through March 31st of 2023, then that payment will be affected a couple years later. So it's at 2024. So it's a 2-year rolling period that it follows your performance period. So everything that you do in this year, your payment will be affected in 2 years, so 2024. So you have a few different reporting options. You can report as an individual, as a group, or as a virtual group. And it kind of lists here on the slide what is available, what you can use. You can see that individual that has an MPI that's associated with the tax ID number, where they are reassigned their benefits to. That is an individual what's considered an individual. Your group is when you have 2 or more NPIs who have reassigned their billing rights to the tax ID number. Most people, if you're a large organization, do submit as a group that includes all of their eligible clinicians. But you can submit either as both, so that's another option. And CMS will choose the highest score between the two. Now, just a little really quick overview of this reporting basics for each of the category. You know, I've spoken about the quality category, and that is required to submit at least 6 measures. One of those have to be a high priority or outcome measure that must be included for this. CMS web interface is one way that you can submit, but those require 10 measures. This is the last year for CMS web interface. If you're a large organization and you have always used that submission type, this is the last year that you will be able to do that. So just be aware. And they've also included 3 claims-based population health measures that are included in quality that are automatically associated based upon your claims. And so those 3 are your hospital-wide, 30-day all-cause unplanned readmission rate for your groups. And then they have that risk standardized complication rate that follows elective primary total hip arthroplasty and your total knee arthroplasty and that includes everybody. So that would be included. And then you have a clinician and group risk standardized hospital admission rates for patients with multiple chronic conditions. And that's only applicable to your groups or virtual groups. So those are 3 claim-based measures that are included on top of those 6 quality measures that you submit for. And then you have cost. That is a category that has 25 different measures that you could be scored on. The first 2 is your MSPB and your total per capita cost. CMS will look at that to see if you meet those thresholds in order to get scored on that. And then there's 23 episode-based measures that are included, and CMS will automatically evaluate those. Nothing that you have to do or submit, but they'll determine if that's included. And then you have improvement activities. It's based off 40 points is the total possible points in that category. So that's what you're shooting for. There's medium weighted activities and highly weighted activities. You need to get 40 points. However, that takes you to get to 40 points. How many improvement activities you'll need to perform in order to get that. If you submit as a group, then you must choose 50% of your clinicians in the group have to participate in that same activity. So know that. And if you are PCMH or PCSP certified or recognized, then at least 50% of your locations under your tax ID number have to be certified in order to get full credit. Because if you do have PCMH or PCSP, you do get full credit for this category. And then lastly, the promoting interoperability category. It's 100 points raw. Points is required for max amount of points. And you're based upon your performance in the different 4 measures. And then there is some bonus potential with in that category, and you do have to have a 2015 cert. Okay, and then as we move on to your submission requirements, there you have a submission type. Direct would be maybe if you use a registry or your EHR vendor directly uploads and submits data on your behalf. Most people, I will say, will log in and upload will be their submission type, or log in and attest. And that's where you log into the QPP portal at your submission time in that first part of the year, and you'll upload your EHR data, and then attest to your PI and your IA categories. And then, like I said earlier, you will have the choice to submit as an individual, group, or both, and use maybe a registry, your third-party intermediary. So you have that option. So that brings us to kind of ends the overview, quick overview of the MIPS program. And now we're going to talk about eligibility. And with that, I am going to pass this on over to my colleague, Robin, and she is going to take over.
Thanks, Vance, and thank you everybody for joining us today. We're going to start into reviewing eligibility as it applies to both the individual programs within Quality Payment Program and APMs, and maybe just a little touch on MVPs, but not much there. So as a reminder, fortunately, the eligibility requirements haven't changed much the last couple of years. We're not going to hold our breath that it'll continue to stay that way. But as we mentioned earlier, there are two models for provider participation under the Quality Payment Program. We are in year 6. And again, as I mentioned, we're fortunate that we haven't saw significant changes in provider eligibility. It has been a slower transition as for this group as it has been for others. Additionally, as CMS reviews participation, they are actually seeing more providers move from the MIPS track over to the APM model. So I think as they recognize that there's some newness to that program, they are slower to make significant changes in the eligibility requirements for the program. So as a reminder, to be required to participate in MIPS, we have to have $90,000 in Part B billing, have at least 200 Medicare beneficiaries, and provide at least 200 professional services during the snapshot time periods. For the APM model, your APM must be labeled by CMS as an advanced APM participant, and 50% of your Medicare payments must come through that APM model, and at least 35% of your patients should be enrolled in the APM. If you don't meet these requirements, then you're subject to the MIPS program participation and the positive and negative adjustments that come with that program. To be MIPS eligible only, you must also be a clinician type, and so we've listed those at the bottom of the slide here. For program year 2022, CMS did add 2 new eligible types, and that is certified nurse midwives and clinical social workers. Again, while there are numerous types on this list, you must bill Medicare using a tax ID NPI combination for you to be included in the eligibility requirements. So if you don't individually bill Medicare, that's why you don't see yourself as eligible. A lot of our folks are part of hospitals and systems, and so they have a group NPI and it puts that group eligible, but a lot of times it doesn't put any of our providers. And so that's sometimes why you don't see dietitians or some of your therapy folks eligible. But if they're in private practice and billing Medicare, then yes, they are subject to be reviewed for eligibility. I think we might have mentioned this earlier, but just as a refresher, so you can be eligible at the individual level, or you can be part of a group who's eligible. So if you are MIPS eligible at the individual level, then you must report or complete a hardship exception application. Being eligible at the individual and reporting at that level allows the provider to select the best measures to be submitted for that particular provider. So maybe they score higher in some categories or some measures than maybe the group, so they can individually select which ones they want to submit. And then that payment adjustment is based on your individual score from the MIPS performance categories. And if you are part of a group and there is a submission at both levels, at the group and the individual, CMS will pay you that adjustment based on the higher of the 2 scores. The group submission, the entire group receives payment adjustment based on the group score. And you can, as I mentioned, receive the higher of the 2 if you submit at the individual level as well as the group. If practices choose to participate as a group and there are clinicians who aren't required to participate, they will have their information included in the group, their NPI, all of their patient data is included. So therefore, they'll receive the same adjustment as other providers in the group who maybe were eligible. So that's something that you all need to decide early on in the year how you really want to participate. It may be that you have some providers that really do well as an individual with meeting their quality performance or maybe PI, and so you do want to go ahead and submit for them on an individual level, but then also submit the group. So there's perks to both. When you work with us at the REC, when we complete our gap analysis, that we can kind of help you walk through that process individually versus, through a webinar of some sort. When determining eligibility, CMS for the MIPS track looks at it at 2 different time periods, and it's usually 2 years prior. It does include the current performance year, but only 9 months of that. So we'll see that there's 2 segments there. The initial eligibility runs October through September of the prior year, and then that's usually posted in late March of the following year. And then we'll see October through November of the current year, and that gets posted generally in December. So what we'll see for 2022 eligibility, that first snapshot will be revealed here just in a couple, I don't know if it's out there yet, but it may be out in April. And then we'll also see this again posted in December for folks. When you're reviewing your eligibility, you're going to see some special statuses, and these can apply to both the clinician and to the practice itself under the tax ID. And so this is just a glossary. I'm not going to go through every definition for you, but just keep in mind that these special statuses impact how you report in some of those categories, and it actually has some flexibilities built in there for you. One of the things here, like with the small status, that is affecting your quality category. For small practices, you automatically get 6 points added to your raw score within that category, whereas larger organizations won't get that. So those are important to know. Some of the others impact your improvement activity category as far as weighting. So Vance mentioned earlier, I think that some of those are highly weighted or medium weighted. When you have some of these special statuses associated, you actually can report fewer improvement activities based on that weighting. So there are there's some perks to being a small practice or having some of these special statuses associated. I think I touched on this, but I kind of just to reiterate it, when you sign into your organization's QPP portal, you'll see some additional information that's not included in the generic NPI search on the home page. And here in a few slides, I'll describe that a little better for those folks that's never participated in this program. But when you actually sign into the QPP portal, you can actually see provider billing amounts and provider professional services provided and the beneficiaries and such. And you'll also see if they are included in an APM. And should you all, with some more experience, want to participate in a virtual group, it'll also have that information tied if you've submitted that to CMS and it's been approved. One of the flexibilities that was added a couple years ago was for providers to be able to opt into the program if they meet one of the 3 required thresholds. When you search for that provider under your eligibility list in your portal, you will note that there'll be an option there that says opt-in eligible. And what that means is they have met one of these thresholds, they just don't meet all 3 of them. And the neat thing about opt-in is that you can wait until the end of the year to make that declaration to opt-in. If you make that early and decide later that maybe your quality scores aren't quite where they need to be, you can't rescind it. So once you make that declaration, you are bound to the reporting obligations. And at that point, if you can't meet it, then you're subject to those payment reductions. So it's fortunate that that opt-in option is available to you until the end of December. So we talked a little bit about the snapshots earlier for MIPS. APMs have this similar, but they have more frequent determination periods. And so if you know that you are participating in an alternative payment model, CMS actually does 4 reviews for those. So potentially you could submit MIPS information for a provider prior to that final snapshot too. So just keep that in mind, that QP status could change up until the last minute. QP determination does supersede that MIP submission, so the provider would be eligible for the hire. You can't receive both. So if you went ahead and submitted MIPS under the group, or you were included in a group submission, but you are designated a qualifying participant under an APM, you'll receive the money associated with the QP, with the APM status, not with MIPS. So just keep that in mind. You can't get both, but you could potentially be included. So I mentioned earlier that there was a homepage for eligibility. And I think if you've been out to the qpp.cms.gov website, you'll notice on their very front page, the first thing you see is check your participation status. And in this case here, you would just simply type in an NPI number. Anybody can do that. It's not locked down. It doesn't require password attachments or whatever. So if you use the NPI lookup tool found on the homepage, you'll see the clinicians connected to the practices. So they could be connected to multiple practices. This is from PACOS information submitted by organizations. So if you've had a physician that has new to your practice or has left your practice, they still may be showing up here on this participation tool. It's not a real-time connection between PACOS and QPP, so it may take some time for them to come on or fall off. What we encourage folks to do when you're working with us is to double check that periodically. And if we see closer to the end of the year that you have a new provider who's not been connected to your practice under the program, then we'll have you reach out to the QPP help desk and work through that process. Again, another snapshot here. So if you're looking at a provider's eligibility report as you selected it from the home page, the information tells you that they do exceed, or maybe they don't exceed any of those thresholds, but it won't tell you at what point. You know, if they maybe saw fewer than 200 beneficiaries, we'll get into it later, but it won't tell you the exact amount. It just tells you, yes, they've exceeded it, or no, they haven't. You'll also be able to see at the clinician level and the practice level the thresholds for both. In addition, their special statuses for both. It's just somewhat generic, and it doesn't tell you how much or how far away they are from meeting those thresholds. So if you have a HARP login, because that's what you'll need, when you go to the QPP homepage, you'll see the tabs here at the top that say About, MIPS, APMs, Resources, and then our friend, the fabulous Kelly, has actually provided some screenshots for us, but where her name is, you'd see the QPP sign into your account, and you would select that. I mentioned a HARP login. If you do not have a HARP login, you'll be directed to create one at this time, and it'll walk you through that whole program. Again, if you're creating a HARP login, you'll be asked to select what roles you need and things like that. So it could be fairly quickly, or it could be take a few steps to get your login. So we don't recommend waiting to the last minute at time of attestation to try to get your HARP account straightened out. You want to do that early on in the year. So as you log into the organization's portal on QPP, you're going to see this welcome page. And while our example here is from 2021 with some 2020 reporting information, the layout of the website is the same. It hasn't changed throughout the years. And then you'll see in that left blue banner that runs up and down the screen there, eligibility and reporting as an option to select. Selecting this option takes you to the clinician list associated with the practice and provides you with the clinician and practice thresholds and special statuses. It will also tell you at this point how many practices are available for you to view. And while it says practices, we know that some larger organizations have multiple tax IDs associated. And so it lists those practices by tax ID. So I have a couple hospital systems that have 2 and 3 tax IDs that they bill under because they're so large. So what if you feel like you're missing something at this point, this is also where we'd reach out through your HARP login and make some requests to add those additional tax IDs. So by this practice showing here, it shows that Kelly is authorized to review and or submit information on their behalf. And that's where I discussed earlier about when you requested your HARP login for what roles you had. So there's a security official who can review and submit and, gather reports. And maybe there's a staff official who can only submit but can't get any of the reports. So it's important that you know what you need to when you make that request. So as we saw earlier, she has a connection to 2 different practices. If we look here at the screen, right underneath practice 1, we see MIPS eligible. And in this case, we've blotted out some of the identifying information here. So next to that exceeds low volume threshold, or right below that, we'd see Medicare patients at this practice, and it would give us a total amount of Medicare beneficiaries seen underneath that practice, the total allowed charges that were billed, and the total amount of covered services for that practice. And then some additional information that you see on this screen, and I'll talk about it a little bit later, is they have applied at some point for an extreme and uncontrollable hardship, and so that's populated here that it's been approved. So there's lots of information here as well. And then if you'll also notice right below that, you'll see a little plus sign that says View APM Entity Details. You could select on that link and it would populate the APM participation for the tax ID. To the right of that, we see View Clinician Eligibility, and so you would click there and it would list all of your connected clinicians within that tax ID. The practice 2, similar, it looks the same as far as eligibility and MIPS eligible, they applied for a hardship, but if you'll notice below that, there's no option to view APM details. So that tax ID is not part of an APM. So lots of good information here. If you selected a practice under their practice details and clinicians, you'll see here that we have MIPS eligible, and it'll say next to it, clinicians final eligibility. So that tells us that there won't be any more updates related to this particular program year, and that they also qualified for the extreme and uncontrollable circumstance hardship, and it's listed there below as well. And right above that, with the plus sign, view complete eligibility details, you would select that and see the eligibility notices specific to that provider, to that clinician. And as we click through that and we get to our clinician status here, we see that, again, it's final eligibility. If you'll look there, it says MIPS eligibility, and it's sort of grayed out, the circle, and it says individual, and then the group next to it is green. I know the slides are a little hard to see. They're a little bit pixeled, but these are screenshots, and sometimes you lose some of that clarity. But if it's green, then they are eligible at the group level. If the word individual is green, they're eligible at the individual level. I know it's very basic, and I'm really keeping it down, but that's what you're looking for. Those are key things to look for. And then, of course, here we mentioned earlier that link for viewing complete eligibility details. You would click on that, and it would give you the exact billing number, the exact number of patients seen, professional services given, those kinds of things will all be listed there, as well as their APM. So I have talked a few minutes there about eligibility. Vance is going to finish us up. One thing I didn't mention earlier is if you have any questions, feel free to put them in our Q&A there, and we will address those when we're finished. Thank you so much.
Thanks, Robin. Yeah, there's a lot of great information on eligibility. I'm sure that it's a lot of information for those of you listening, and hopefully that kind of pinpointed some information for you. But if you still have questions or would like assistance, we're going to just kind of walk through you some steps of how, the REC does provide help as you're going through this MIPS program. We do have a team of people. I did share a list of our team earlier in the presentation for advisors to really partner with your organization to help, define your priorities and select some measures that are meaningful, track and monitor your progress and your priorities across different programs to help really meet those goals for your organization. We try to consider different MIPS categories, your current workflows, what other programs are you working on with your payers, maybe HEDIS, STAR programs, your Kentucky Medicaid program and UDS systems. So all of those are things that we kind of help with as you are preparing for the quality payment program, and consider all of those different things with that. So if you do decide to reach out for us for help and partner with us to help you with your MIPS program, we're going to help you with the eligibility, help you how to determine who's eligible, who you should, who needs to submit, those kind of things, to provide that guidance with that. Also, there are different things that happen throughout the year with legislative changes. So you have your final rule that's usually, or your proposed rule that's usually comes out in the late summer, and then your final rule is sometime the late fall, around November, December. And so we provide guidance on that, what changes are being proposed or what are in place, and just provide that information, as well as different changes throughout the year. With COVID, we have seen a lot of different changes in this program as far as hardship exceptions and those kind of things that were happening throughout the year, and we do provide that information for our clients. Also, performance feedback, that is something in the MIPS program that happens around July. So after the submission period ends in March, the end of March, then CMS will calculate everything, review, finalize, and then provide those performance feedback results in July in that QPP portal. And we really help you guys review that, make sure everything looks correct based upon your submission. And then if there's any discrepancies, then we could help you file that targeted review and have CMS relook at that to make sure there's no error. Also, we help with your workflows. You look at your data that you provide us on a regular basis, so we can do a gap analysis to do some quality improvement suggestions for you, how to improve those throughout your year. And then just kind of get that plan, get an action plan in place, and how to maximize your performance and strategize across the different programs, and try to kill one bird with, or two birds with one stone, so to speak. So you're not exhausting too much energies on multiple programs. And also, you're going to get assigned an individual advisor that works with you regularly. They can answer your questions. They're your go-to person. But like I said, we have a team here, and we rely on each other. We all have our strengths that we're really good at, and we have a great group here that we can go to and depend on for additional advice and information. So we also do data validation for your attestation. Make sure that things look correct. If your numerators, denominators look off, maybe provide some support on how to validate that. We also have resources that we provide our clients, and that could be anything through these webinars that we provide for clients only. Some of our webinars, we provide one pager tip sheets that we provide on different categories and different resources for our clients. So that really kind of covers everything that how we can assist you. So if you have questions, please always feel free to reach out to us, and we are happy to help. Please go ahead and put any questions that you may have from today's program in the Q&A, and we will get to that in just a second. And as you all are putting your questions in, I did want to remind you some upcoming webinars that we are going to do on March 22nd at noon. We have a telehealth webinar that's going to be being done, and it is open to the public, so anybody can join. And then on April 20th at noon, we are going to really do a deep dive into the quality category. And this is for our clients only. So if you are a client of the RAC, this is one of the benefits where we kind of deep dive into that quality specific category. We do offer telehealth services, one of our newer service lines, to really provide some tailored service to meet your needs for telehealth implementation and optimization. And you can see there what that services include, such as your readiness assessment, a toolkit, some education and resources, and then some guidance and best practices for telehealth. We also offer the security risk assessment. So they now have a virtual HIPAA security risk assessment that can be done. There's also the on-site SRA, your vulnerability scanning and assessment, can't talk today, and the HIPAA vulnerability remediation, and the security and awareness education and training. So our security and privacy team can help out with that service. And if you do need to contact us with questions, please reach out to us. There's our phone number, our website, an email address. We can also be contacted through Facebook, Twitter, or LinkedIn. So please reach out to us anyway. We're all happy to help answer any of your questions. So now I just want to go back to our, see if we have any questions here. And Robin and I are going to, let's see. Well, go ahead and enter any questions that you may have. We'll give you all another minute or two to get that up. Let's see. One of our questions is, any chance will a recording of this presentation be available? Yes, so the recording will be sent out probably in the next week or so. That will be sent out, so be looking for that. Let's see if we have any other questions. What happens, here's one of the questions. So what happens if you don't submit for this program? We've never been penalized before. So I'll answer that question. If that happens, earlier on in this program, the requirements were a lot less stringent. So it would have been very easy to maybe be eligible for the program, but not submit, but still meet the thresholds where you don't receive a penalty. Now the program has gotten a lot more stringent. For this year, you have to get at least 75 points or higher, 75 points or higher in order to avoid penalty. So you may not be able to avoid penalty without submitting anymore. So be very wary of that and be knowledgeable of what clinicians are eligible for this program in order to avoid that penalty. So just be thinking of that. One of the questions is, did we address the extreme and uncontrollable circumstance for 2022. So, Robin, do you want to answer that question?
Yes, I was seeing that here in the chat. And so, no, we actually did not talk about anything related to program year 2022 as far as EUC goes. That actually won't even be available for application probably until later. They are currently have open the EUC for 2021. So if you didn't apply, CMS went back and reopened that option for 2021, but nothing has been decided on 2022 yet. It'll probably be the same process in the past, I would suspect. And if you're curious about COVID and public health emergency, I think that'll all kind of roll out over the next few months. It's expected at this point, it's supposed to expire on April 15th as far as public health emergency. We haven't heard anything one way or the other if it'll be extended or not. So I think that'll give us, it'll be very telling on how program year 2022 is going to look based on whether or not they extend that past April.
Great, thank you. Another question is, can we report at the group level and individual levels if they're eligible for both? And so I'll answer that. Yes, you can report at both levels. And CMS will determine what that highest payment or the highest score is to determine your payment. So just know that you can report at both if you're eligible. Let me look and see if there's any other questions. On the QPP side, all of my clinicians are opt-in eligible at the individual clinician level, but our practice is eligible to report at the group level. Are we required to report at the group level? So you can do both if you're either one, as long as the clinician that's listed is covered. So if you have an individual clinician that is eligible individually, then they must report, do either group or individual, or you can do both. As a new practice, from where we should start to participate. Do you want to answer that one, Robin?
Yeah, I will. So the first thing I would do is go out to that QPP homepage and click on portal and go ahead there and begin with getting your HARP account so that you can log into the portal and you can look at your eligibility within your organization. A new practice, it leaves a lot open there for me to make some assumptions. So when you say new, does that include providers who are brand new to Medicare? If so, you've got a year before that you'll be evaluated for participation, so you've got that. If you're a new practice, as far as you've got a group of physicians who've been practicing for a while and they come together as a group, you know, and establish a new business, they may carry over some of their eligibility. It just really depends. Ultimately, your very first step should be to go to qpp.cms.gov, click on QPP portal there in the top right hand, and then when it asks if you to sign in or register, click register and start there with your HARP account. And of course, you want to work with us. So you'll reach out to us and we can help guide you too.
Perfect. Well, I do not see any other questions. If you do have further questions, please reach out to us by one of these means here listed on the screen. A recording will be sent out later. Thank you again for joining us all, and have a great day.